Welcome to an introduction to healthcare through telemedicine. This video is part 2 of our 3-part series. The Midwest Genetics Network created this video specifically for patients and their families to increase their awareness of the benefits of seeing a healthcare provider using telemedicine. In this video, we'll take a look at what you can expect during a telemedicine appointment. This video will help you answer the following questions. How do I prepare for my telemedicine appointment? What can I expect during my telemedicine appointment? What do I need to know during the telemedicine session? How do I prepare for my telemedicine appointment? It is helpful to prepare for your telemedicine appointment. Be sure any paperwork is completed and returned as requested. This may include your health history and copies of any previous medical care and testing. This information will be forwarded to the healthcare provider to review. On the day of your appointment, consider choosing clothing without bright colors or bold patterns, and avoid accessories that make noise. These things will minimize distractions and improve video and audio quality. Just like a face-to-face appointment, it can be helpful to write down any specific questions you may have. This helps you to be prepared and to get the most out of your time with the healthcare provider. What can I expect during my telemedicine appointment? Basically, a telemedicine session is similar to a typical office visit, with the only difference being that you and the provider see and talk to each other through a television, computer screen, tablet, or smartphone. You may participate from a hospital, a doctor's office or clinic, or other location. Your location is called the originating site or spoke site. You may hear it called by these terms. During the appointment, you will meet the provider from another location using secure video conferencing. The site where the physician or other practitioner is located is called the distance site or hub site. When you arrive at the originating site, there will be someone there to greet you and coordinate your telemedicine appointment. They will provide support, guide you through each step, and manage the technology. Before your session begins, ask the staff to orient you to the equipment they will be using. They can show you where the camera, microphone, and video screen are located. Sometimes these things are all together on a cart called a mobile telehealth unit. If specialized equipment will be used for a physical exam, this will be demonstrated to you as well. Staff will tell you when the telemedicine session is beginning and ending. It is okay to ask questions if you need to. There may be others in the room with you during your telemedicine session. A healthcare professional, such as a nurse, may be present to help complete a physical exam if needed. Your privacy will be respected, and anything you share will be kept confidential. The same healthcare privacy standards apply to telemedicine as with any other medical treatment. What do I need to know during my telemedicine session? Here are some guidelines to help your telemedicine session go smoothly. Avoid eating or drinking during your appointment and mute your cell phone. Extra noises can be a distraction. Gestures and body language can be lost on camera. Be sure to speak answers clearly, as a nod or shrug may be more difficult to see. Speak clearly in a normal tone of voice. There is no need to shout or lean toward the microphone. Everything will be set up ahead of time to make sure you can be seen and heard clearly. Be patient. Wait for the person on the other end to stop talking before speaking. Audio does not travel well in both directions at the same time. An interruption on either end may result in miscommunication. As with any technology, there is the potential for minor glitches to occur. Don't worry if this happens. The provider is trained to deal with any problems that come up, and they will work as quickly as possible to resolve any issues. This concludes Part 2 of our series. Please continue to Part 3 to learn more.